Are you a runner or fitness enthusiast, someone who's just trying to stay mobile and active during your life, and is hip pain slowing you down? Well, we're going to continue this week. This is for you. So typically, history of some hip pain we'll typically hear from people is it hurts to do X. It hurts to squat. It hurts to lunge. It hurts to deadlift. It hurts to go up and down the stairs. Big one. Hurts to sleep on that side at night. Hurts to sleep on the opposite side at night. Some typical things that we usually hear. One of the things we really try to flesh out during the visit here is it's something that the things that hurt all the time. First off, if they don't hurt all the time, or sometimes something hurts, like sometimes going up the stairs hurts, sometimes it doesn't. It's telling us that there could definitely be something going on joint related. Where that's coming from the hip joint or elsewhere, that's also what we determine later on. But if it's one of the key symptoms and signs is it's the pain a lot of times is intermittent. Hip pain necessarily it doesn't necessarily have to be intermittent. It can also hurt all the time. Depends on the series and kind of the phase on where the injury itself is at. But hip pain can also be sharp, burny, achy, dull, tight. Has a whole bunch of different descriptors. And one of the things that we also really want to get into and figure out as well is what part of your life is now difficult, challenging, and impossible to do because of hip pain, because that's one of the things we want to look at long-term, getting you back to. And also one of the things that we look at to kind of track just to see our progress, just to make sure we're making functional improvements along the way. The other thing we really then want to get into is, once we get a good history of what's going on, is we really want to get into a good assessment of what's going on with the hip itself. And we think that our assessments, we run things slightly differently because we know that if you've followed our stuff before, we know that what sometimes is causing pain in one area could be coming from another. So that's one of the things we're going to start to really try to figure out the first visit or so, and just to make sure that what you're feeling in the hip joint, remember the hip joint is where our leg bone, our femur attaches into our pelvis, our acetabular joint, or our femoral acetabular joint. Is it actually a problem there at that joint, or is it a problem somewhere else? So anytime we have a problem at a joint, so in this example, if we actually had a true hip pain or determined to be a true hip pain, any muscle that attaches or crosses that joint at the hip, in this case there's a lot of them, can be causing that pain. So that's why some people can have, who have hip pain, can have pain in the groin, they can have pain in the front of the leg, the thigh, the quad, the hip flexor, whatever your area you want to call this. You can have pain in the side, can be through the glute, can have a deep pain deep in the butt. It can be a different presentation, but can still be the same reason, the same cause behind what's going on. And that's really what we get into when we start to try to flesh this stuff out. So one of the other things we get into is there any numbness or tingling on that side? That's going to be a big key on some stuff that's going on. If there is a history or current history of some numbness and tingling going on that side, we're going to think it may not necessarily be a hip problem. We're going to think it's going to be a low back problem until proven otherwise, and we're going to go after it on that route. Because a lot of times the hip won't actually cause numbness and tingling. That's usually coming from the low back, and we want to make sure we address the low back. And once the low back starts to move and starts to feel a lot better, a lot of times the hip pain just kind of magically clears up and goes away. So looking into different things, we also want to make sure that we're not looking at any, we're going to rule out any big red flags. We're going to make sure it's not actually a disease process or something we need to send you out for. We're also going to figure out the first visit, is this something that needs to be imaged or not? And we're also going to take into account, have you had previous imaging before on this hip? Do we know if there's something going on there, yes or no? And then as we continue on with treatment, we're going to use a lot of those different, kind of look back on those different tests and different things just to make sure that we are improving as we go. So if we're treating the hip or the low back, a lot of the tests that were previously painful, or a lot of your previous activities that were painful, going up and down stairs, sleeping on each side at night, squatting down, lunging, something like that, those should continue we should see progress with that as we go through treatment. And that's going to be one of the things we're going to ask you about pretty much every time you're in, just to make sure that we're making progress. And if we're not, we're going to definitely change tracks and get a little bit more aggressive with the treatment itself. And we're going to make sure that you're doing your home exercises, because the home exercises are also going to be the key into making this go away. Stay with us. We're going to be talking about what some of the assessment looks like in clinic. We're going to talk about what some of our treatments look like, and we'll get into a little bit about how you can avoid some hip pain at home.